The disease that eats you alive, flesh-eating bacteria, necrotizing fasciitis, the flesh-eating disease that spreads faster than fire. It started with a paper cut, a shallow scrape on her hand, barely deep enough to bleed. By the next morning, her fingers were swollen. By lunch, her arm was turning purple. By midnight, doctors were amputating it to save her life. But the bacteria was faster. It didn't just infect her, it devoured her. This is the true story of necrotizing fasciitis, a flesh-eating disease that spreads faster than wildfire and kills more quickly than most people can get to a hospital. And this is the human condition, where every disease has a story. The first case that shocked America. In 1994, Amy Copeland, a 24-year-old graduate student in Georgia, went ziplining with friends. The line snapped. She fell into a rocky creek bed and suffered a deep cut in her calf, painful but manageable. Doctors stitched her up and sent her home. Within 48 hours, the pain was unbearable. Her leg had turned dark red, then black. Her skin was blistering. She was rushed to the ER. The diagnosis? Necrotizing fasciitis, a rare, aggressive infection that destroys soft tissue and muscle. To save her, doctors amputated her entire leg, then her hands, her other foot, and part of her torso. She survived, but only because they moved faster than the bacteria. What is necrotizing fasciitis? Necrotizing fasciitis literally means death of tissue in the fascia, the connective tissue that holds your muscles and organs in place. It's not a virus, not a single organism. It's a bacterial gang, often caused by group A streptococcus, but sometimes by Clostridium, Vibrio, or other species. When they enter the body through a break in the skin, even a small cut or insect bite, they release toxins that destroy tissue from the inside out. Your immune system goes into overdrive, but it's often too late. The bacteria outpace your blood flow, cutting off oxygen to nearby cells. As the cells die, the tissue becomes necrotic. Your skin blisters, turns gray, begins to fall apart. It's called flesh-eating, because that's exactly what it does. How fast does it spread? This disease doesn't move slowly. In some cases, necrotizing fasciitis can spread 1 inch per hour. That's over 2 feet in a single day. Patients report pain that's out of proportion to their injury, a small scratch that burns like fire, or a bruise that throbs like it's broken. This is a red flag. Doctors often misdiagnose it in the early stages as cellulitis, flu, or a minor infection. But within hours, the skin darkens, the area becomes numb, and soon, the tissue begins to die. Without surgery, and we mean immediate, aggressive surgery, the patient will die too. The most extreme survivors. Let's talk about Jim Hlady, a 51-year-old man from Alberta, Canada. Jim had a small sore on his foot. He thought it was athlete's foot. Within 3 days, he was in a coma. When he woke up, his right leg was gone, his left foot had been removed, and doctors were still fighting to stop the infection. He later said, "It took my legs, but not my life." Or David Jane, who went to the hospital in 2006 with stomach pain. Within hours, doctors found the bacteria had invaded his abdominal wall. He underwent dozens of surgeries over 6 weeks. He lost part of his stomach, liver, and intestines. Most people don't survive that long. This is where it gets scary. You don't need a deep wound. This disease can start with a paper cut, an ingrown hair, a blister, an insect bite, even a surgical incision. It's most common in warm, moist environments, places where bacteria can thrive. Saltwater versions of the bacteria, like Vibrio vulnificus, have infected swimmers through small cuts on their legs. In Florida and Texas, cases spike in summer. Some infections occur in hospitals after operations, and some happen at home, from shaving nicks, garden scrapes, or diabetic ulcers. It doesn't matter where it starts. What matters is how quickly you catch it. The early symptoms are often subtle, but deadly if ignored. Stage 1. 0-24 hours. Severe pain that seems too intense for the size of the wound. Fever, chills, fatigue, swelling, and redness. Stage 2, 24-48 hours. Blisters filled with dark fluid. Skin turns purple, then black tissue becomes numb. Stage 3, 48-72 hours. Low blood pressure, organ failure, septic shock, death. The survival rate drops dramatically after 48 hours. Early diagnosis and surgery are the only hope. Doctors treat necrotizing fasciitis with immediate IV antibiotics, surgical debridement, cutting away all infected tissue. In extreme cases, amputation hyperbaric oxygen therapy has helped in some cases, but it's not a cure. The key is speed. The longer you wait, the more flesh the bacteria consumes. Survivors often require skin grafts, rehabilitation, and long-term trauma care, and many never fully recover, physically or mentally. Necrotizing fasciitis can strike anyone, but it's more common in people with weakened immune systems, diabetics, cancer patients, those with chronic wounds or poor circulation, but healthy people are not immune. Many survivors were young, fit, and active when it happened. All it takes is one opportunity and a delay in care. There are about 1,200 cases per year in the U.S. and rising. In warmer climates, like Southeast Asia, the Gulf Coast, and Australia, rates are increasing. Some strains, like Vibrio vulnificus, are becoming more dangerous due to antibiotic resistance. As climate change warms oceans and fresh water, bacteria that once stayed in tropical zones are appearing in places like Connecticut, New Jersey, and even parts of Europe. We are entering an era where microscopic predators are no longer bound by borders. Necrotizing fasciitis doesn't just kill, it disfigures, it amputates, it scars, and it leaves survivors asking one haunting question: how did something so small destroy so much? You don't need to live in fear, but you do need to stay alert, clean your wounds, watch your symptoms, and never ignore pain that feels wrong. Because this disease doesn't wait. If this story disturbed you, good, you're paying attention. The human condition exists to explore the mysteries, monsters, and horrors hidden inside our own biology. And the deeper we go, the stranger it gets. Subscribe now, because next week's story is even darker. The woman who couldn't stop bleeding, and the clotting disorder that nearly killed her. Thanks for watching. And remember, sometimes the scariest things aren't what you can see. It's what's hiding under your skin.